Thanks for joining us. My name is Lisa Silverman, and I am URAC's Client Education Specialist. I'm here to move things along today. Our style, we love to know who you are, so we use a very active chat box, and I hope you'll join us in there. So please use the chat box. Tell us who you are and where you're from. I'm based just outside of Washington, D.C., here in Silver Spring, Maryland, and it's great to be with you today. So we love knowing who you are. I am joined today by my colleagues, Jeff Wusso. He's our business development executive working with part of our pharmacy portfolio and clients. I am joined by Heather Bonome, who is our director of pharmacy. She's going to be on stage for a while. And then Laura Wood, who's our program lead for our new mental health at work program, which you'll hear more about towards the end of the webinar. So like I said, if you want, please, we'd love to have you chatting in who you are, where you're from. I realize some of you are still heating up lunch or having that last cup of coffee, depending on where you are. But please say hi and chat with us in the chat box. We're a friendly crew. Along the way, the speakers know that I may interrupt them to offer space for your questions. So please don't hesitate to put questions in. I don't want your questions to have to wait until the end. There's a great spot where we can answer them. So here's our agenda for today. We're going to tell you a little bit about URAC. Some of you know us, some of you may not know us. So we're here to kind of set up who we are, talk a little bit about why accreditation matters. Hello, Amani from Chicago, working in Florida. I hope the weather there is nice today. We'll talk about the programs that we have that can help you achieve your business goals. We know that's sort of the purpose of today's webinar is to get you thinking about what are your business goals and how does accreditation and how can URAC help take them to the next level. Then Jeff will come in and talk about the accreditation process, and we'll have questions at the end. But like I said, questions throughout are more than welcome. And with that, Jeff, I'm going to turn it over to you.
Perfect. Thank you, Lisa. So again, my name is Jeff Wusso, and I'm a business development executive with URAC. I want to thank you for all attending today. Our goal today is to provide an overview of URAC and accreditation and to introduce you to some of our programs that align with the work your businesses do every day. Next slide. URAC is a nonprofit independent accreditor, and we exist to improve quality in healthcare. URAC's clients include not only pharmacies, but independent review organizations, hospitals, health plans, and many other organizations in the healthcare industry. We're proud to offer accreditations and certifications to organizations that have tens of thousands of employees and to organizations that have less than 10 staff. Next slide. URAC has been improving quality in healthcare for nearly 35 years. Again, we're an independent accreditor, and we do not provide consulting services. We also know that partnerships are the key to our work, and we are proud to be a corporate member of NCPA. URAC has an NCPA representative on our standing advisory committee, the Pharmacy Advisory Council. So a member of NCPA represents you on URAC's official committee. Next slide. So for those of you not familiar, what is accreditation? Accreditation is an independent review of an organization's policies and procedures showing that they meet URAC standards. The process validates quality through a review of all relevant policies and procedures submitted to URAC. We then conduct an on-site visit to our clients where they demonstrate that they're following their policies and procedures in their daily operations. We take an educational approach as we provide feedback to our clients throughout the entire accreditation process. And finally, achieving accredited status shows an organization's commitment to quality. We pride ourselves in keeping the accreditation process fair and completely free of bias. And our reviewers are all clinicians and average 20 years of experience in healthcare. Next slide. On this slide, I'd just like to point out the middle in the red there. URAC listens to its clients. In the past few years, URAC has developed affordable pricing for qualifying small businesses for our specialty pharmacy and mail service pharmacy accreditations. This allows independent pharmacies the ability to achieve the same accreditations as CVS and Walmart at a greatly reduced cost. Next slide. URAC offers over 40 accreditation and certification programs, and we're going to provide a high-level overview of the programs in red. And for this, I will turn things over to Heather.
Thank you so much, Jeff. Good afternoon, everybody. Good morning, maybe to some of you. My name is Heather Bonome. I am the Director of Pharmacy with URAC. I am a pharmacist. I've been with URAC for almost 10 years. And in this role, I get to manage the pharmacy practice of accreditation. So really the right side of your screen, those programs, I work really closely with them. I manage the team of pharmacy reviewers that conduct the accreditation reviews and audits. And I also get to work really closely with our advisory groups to develop and revise the pharmacy program standards that make up our programs. As Jeff mentioned, we offer all of these accreditation programs that you see on your screen, but we feel that there are some that we want to share a little bit more about with you because we feel like they really align with the priorities of the NCPA membership. So I'm going to talk about the pharmacy programs, and then I'm going to invite my colleague Laura Wood to talk about some of our newer programs that we think also align really well: community health worker, health equity, and mental health at work. Thanks. All right, so I wanted to start with our Pharmacy Services Accreditation Program. I'm going to spend a little time here. I want to start with this program because it was specially designed with community pharmacy practice in mind. So we know that community pharmacies are a key clinical resource within the community and provide the fundamental pharmacy and dispensing functions and usually many other clinical services as well. And this program really recognizes those other clinical services and provides a framework for some of those other clinical functions. This is a modular program, so organizations who want to get some recognition get to choose from the modules which applies to them. So we have vaccine administration, point of care testing, drug therapy management, and community dispensing as those optional modules for selection within the accreditation program. And we worked with our advisory group to determine which modules to offer, because again, we recognize the community practices offer a whole host of different clinical services in addition to some traditional dispensing functions. The advisory group really helped us narrow down to start with these four. But certainly in the future, we may expand the modules to some other programs as well. So let's talk a little bit about, so we talk about, accreditation program. Accreditation programs are made up of standards. We organize those standards into focus areas. So as I go through the different programs today, I'll refer to focus areas. So these are the groups of standards, and it really helps us to understand those functions that the accreditation program focuses on. So if we look at our screen, we've got foundational focus areas on the left-hand side. All organizations demonstrate compliance with those foundational standards. And then on the right, each of the modules has different standards that apply to them. Go to the next slide. Okay. So this is a breakdown of the foundational focus areas that are really, again, the foundation of the Pharmacy Services Accreditation Program. And these represent quality principles that actually apply across all of URAC's accreditation programs. So whether you're a pharmacy or a health plan, it is important to make sure you have quality policies and procedures around risk management, your operations and your infrastructure, your performance monitoring, like your quality management, as well as consumer protection and empowerment. So those are really, again, very foundational. And then in the pharmacy services program, we also have a medication safety focus area. Of course, medication safety is a key area for all pharmacy practice. So there's a component here about what data is collected and analyzed regarding the safe medication use to ensure that the pharmacy is implementing strategies that promote safety. And again, so any organization seeking pharmacy services accreditation is going to start with compliance with these standards. And then I'm going to move on to the different modules that each have their own specific standards And again, modules, you only demonstrate compliance with those functions that you've selected. The first is the vaccine administration module. And certainly the community pharmacy is, a key provider, a critical provider of vaccination services. We all know how this significantly grew with the pandemic. And at this time of year is certainly a huge focus and priority for pharmacy. My son and I just got our COVID booster and seasonal flu shots last Friday at our local community pharmacy. And we're aware, of course, that this is an area of focus for NCPA as an organization as well. See that there was just a webinar a few weeks ago on talking about different vaccination strategies for community practices. So these program standards help pharmacies to provide structure around their vaccine program. So, when you're developing your program, what is the structure? What's the oversight? What's the scope? What are we going to offer here? Who is going to be providing the services? What are the regulatory implications? What kind of training, certifications potentially, and education does that staff need? And when we're administering the program, how are we assessing patients for appropriateness? What kind of education needs to be provided? What do we need to consider after administration? And how is everything being documented? Certainly, coordination of care is key, utilizing different registries. And then you'll see that this runs throughout all of our programs is ensuring a program evaluation. So at least annually, we're looking at specific metrics. The pharmacy is looking at specific metrics to say, hey, what are our goals with this program? Are we meeting those metrics? Is there anything that we need to do differently? And really the value here of this module within the program is to demonstrate to partners and potentially even patients, this service has been reviewed and verified from a quality perspective. Next slide. Thanks. So point of care testing is our next module. This is another area where we know that NCPA has been focusing with offering the guide to implementing point of care testing services that the association has made available. And actually, this is a pretty similar flow as the vaccination program standards. It provides a structure to ensure that the development of the program considers the scope, any regulatory considerations about who's permitted to participate in the program and offer the services, who will be responsible, what clinical protocols and guidelines should be followed. From an administration perspective, how do we know that it's the right patient with the right test? What kind of education do they need? Once results are received, what happens next? And how is everything documented? Coordination of care, again, always key to look at the whole patient with all of their providers. And then program evaluation. What are the different performance metrics? What was the patient's experience with that service? What clinical indicators do we need to look at? Are there any interventions that occurred as a result of the test that could or should be tracked to make sure that the program is meeting its goals? And similar to the vaccine module, the value here is really demonstrating to partners and even patients that this service has been reviewed, verified from a quality perspective. The third module here is drug therapy management. So it's a little different structurally from the first two. So this is verifying the quality of a drug therapy management or medication, MTM therapy management program. At URAC, we've always called it drug therapy management just to differentiate because it's not specifically structured exactly to the CMS MTM requirements. Although it aligns, it's not based on it and a little bit more broad in scope. So again, when we're looking at a drug therapy management program, who is it being offered to? What is the scope? What are the services being provided? How's everything being documented? From an administration perspective, tell us how are initial clinical assessments being conducted to determine the appropriateness of all the medications that the patient is taking. As a result of that clinical assessment, what does the follow-up plan look like? What are the needs of that patient based on the assessment? How often does it need to be updated? Are there any interventions? And then from a reassessment perspective, how often do I need to reassess this patient? Again, based on those findings, based on the follow-up plan. So it provides a structure and a flow to provide the clinical services to the patient. Coordinating care, making sure that their other caregivers are aware of this information, the plan, and next steps. And again, evaluating the program. What are the metrics? What are the goals of this program? And then who's taking a look at that to make sure that those goals are being met? And if not, what do we want to do to change the program to make sure that we're meeting those goals? Right. The last of the modules within the pharmacy services program is community dispensing. Again, this would be an optional module, even though most of the organizations that seek pharmacy services accreditation are community pharmacy practices and are certainly, dispensing. This again is optional as to if you'd want to pursue this. But again, it is an independent verification that quality practices in medication dispensing are being applied within this practice. So, from an operational perspective, what are the scope of services and what are the pharmacy operations? What does onboarding and prescription intake look like? What does order review and dispensing look like? Procurement, inventory management, and then safety of the inventory. So this is talking about hazardous materials, machine and equipment, any compounding considerations, and wrapping up again with performance metrics. So how is the pharmacy tracking the metrics to ensure that the services that they're providing are meeting the needs of the patients?
Heather, I'm coming on camera to ask you a question. So you've just gone through these areas of standards, but if I'm new to accreditation, I see what you're looking at. But tell me, kind of how do I show you what I'm doing? Do I have to submit policies? What are you looking at? How do you what are you looking at in terms of when you say you want to know my dispensing accuracy? Like that's kind of big for a small organization at times. But what are you looking at when an organization applies? What are you and your team, because you have a team of 15 awesome people or so, what are you guys looking at when an organization starts applying, especially for a small organization?
Yeah. So we purposefully write our standards in a way that organizations, big, medium, small, regardless of the practice, would be able to demonstrate compliance. So when we set a standard, what we ask for, we conduct first a desktop review, which is what kind of policies and procedures do you have in place, or what sort of documentation do you have in place that supports how you meet the standards? You submit that to us in your application, and the reviewer looks at it to make sure it looks like it's on track. And then when we come on site, we conduct a validation review. That's, hey, we saw you have a policy for or an SOP for how you track dispensing accuracy. Great, show us. What's the report look like? What does this look like? So that's how it's in practice. And again, we want to see variety and diversity in the way that organizations meet the intent of the standards. So we do our best not to be prescriptive to say you must use this metric for adherence. Rather, it's how are you tracking adherence? Show us how you're tracking adherence. What is your goal? And we're not setting a goal for the organization either. It's what is your goal and are you meeting that goal? If you're not meeting that goal, are you doing something about it? So those are sort of that's the framework of quality principles versus you must do A, B, and C. It's A, B, and C are required. Tell us how you do it.
Heather, I think that's one of the things I love about our approach is we really do want diversity. We don't want every organization to show us the same policy because your organizations don't have that. We know that, somebody in Montana might function differently than somebody in New Mexico, but they actually might align more closely with somebody in New Jersey in a different organization there. Heather, you mentioned the on-site review, and I think people hear that and it's a little bit like, accreditor on-site review, but I will have to say that our clients have told me I work with clients across all of our programs, and they have said to me the on-site review was actually fun because they love our reviewers. They come in, they learn a lot. I will quote our president and CEO who says, "We don't just expect you to clean the boxes off the shelves. Like we want to see how you're doing your work and connect with you and connect with your teams." And people have said to me afterwards, they're like, I had such a great time with Heidi, or Troy made the experience so wonderful and we weren't stressed at all. And I think that's one of those great things that I love hearing about as a team and as kind of as we are and who our culture is.
Yeah, and really that's why we do the desktop review first, because we want to make sure that organizations do have something in place. They have a mechanism, they have an SOP, they have a policy in place, and they've gotten feedback from us to say, yes, it meets the intent of the standard, or no, it doesn't. And we'll work with the organization to help them understand what the requirement is. All of that is done to help the organization prepare so that when we do come on site for that validation review, that they understand what's expected. And as long as they're doing what their policy says or what their SOP says, they should be in pretty good shape. And one of the things sometimes we have an agenda to get through our validation review day. Sometimes we have to kind of move things along because organizations are so proud of the work that they do, that they want to show, they want to explain, and that's great. We want to learn about everything that everybody's doing, and it's really great to see that pride in the services that are provided.
Heather, I'll stop interrupting you so you can talk about mail and specialty and mail service pharmacy here.
All good. All good. All right, so I will transition from the pharmacy services program to really the pharmacy accreditation programs that URAC is most known for. And that's our specialty pharmacy and our mail service pharmacy accreditations. In addition to the practices that we just talked about in pharmacy services, like vaccine administration and point of care testing, we see a lot of community pharmacy practices expanding into a specialty practice and or a mail service practice. So we've been offering this program for quite a while. We first offered it in 2008 and now have over 500 organizations accredited in these programs. One of the things I think we've talked about already quite a bit is the fact that, within these 500 organizations, we have represented many different models. So certainly there are some larger organizations with multiple sites that are accredited. We also have many independent pharmacies practices. We also have many health system pharmacies represented here. Say from a new accreditation, so from organizations seeking accreditation for the first time, I'd say probably the most of what we're seeing right now coming to us are health system practices starting up, and followed by community practices. We have several pharmacies representing a community practice that are seeking mail service and or pharmacy accreditation right now. The program has grown so much really because manufacturers and payers have recognized the value of the program. And that's really because the accreditation focuses, and we'll talk a little bit more about the standards in the next slide, but it focuses on functions that specialty pharmacies really need to provide and services they really need to provide that aren't included within licensure, state licensure. And so they really want that validation that those services are being provided. An important point I want to note here is URAC does not have arrangements or agreements with payers and manufacturers to say, hey, use our accreditation for your network at access or things like that. Rather, they've recognized the importance of the functions that the accreditation reviews and validates. So let's go ahead and look at what that looks like. Okay, so I spent a little bit of time already on the foundational focus areas. Again, these are those foundational quality standards that go throughout our different programs. And so those also apply to the specialty pharmacy and the mail service pharmacy programs. And then on the right-hand side here, we have the specific program areas. So again, we focus on some things around pharmacy operations. We have a whole section on medication distribution, patient service and communication, and then patient management. I'll focus a little bit on two areas because this is what we hear the most from those external third parties who are looking for accreditation within practices. The first is medication distribution. because so many specialty pharmacies and certainly all mail service pharmacies are shipping medications, there's a lot of focus on the actual shipping process and how do you maintain the integrity of that medication, particularly when there's some temperature sensitivity around that medication through the shipping process. So the medication distribution standards focus on qualification testing of different medication types. So whether it's frozen or refrigerated or controlled room temperature medication, what does that packaging process and procedure look like? What does that pack out look like? And has that been tested prior to use so that the patient knows that the medication that they're getting was maintained in the right temperature range? Once that testing is done and you're providing that service, what kind of auditing to make sure that that continues to work and that the policies and procedures are being followed? The other area that we get a lot of focus on is patient management. And this is specific to the specialty pharmacy program. And this is really, we usually say, what makes a specialty pharmacy a specialty pharmacy. So as we all know, specialty medications are very complex and require a real high touch service. And this is really those high touch services. So when a patient is presented, what is that initial clinical assessment to make sure that this is the right medication for that patient? What kind of initial education is provided? Because there might be some really significant side effects or follow-up testing or other ongoing monitoring parameters that the patient is going to be much more successful if they know upfront what to expect within that medication. Periodic reassessments to make sure that the patient is maintaining their therapy. Have they experienced any adverse events? Are they getting the follow-up that they need? What are their goals of therapy? Are they meeting those goals of therapy? All of that is encompassed into the patient management program, also with some set metrics and goals to be measured to make sure that all of these services that require a lot of work, right, that are being provided to the patient are actually providing the patient with the services that they need. That's okay, very good. Thanks. And again, we've said a few times that really all sizes of organizations have sought and achieved accreditation in many of our programs, but specifically in the pharmacy programs. Several years ago, our CEO joined URAC about 5 years ago. Our CEO is a family practice physician from Iowa. So community practice in general is very close to his heart. And one of the first things that he heard specifically from community practices were that they were concerned that they weren't able to afford accreditation. They really wanted to start a specialty pharmacy practice, but they couldn't start the practice because they couldn't get into network, because they couldn't afford accreditation, and they needed accreditation, and so on. And so we've always taken an approach that larger organizations pay a higher fee for accreditation. So we've always had a tiered approach. But what we were hearing is that even the first tier was too high for some of the smaller practices. So we implemented our small pharmacy program, and this can apply to both specialty pharmacy and mail service pharmacy. The accreditation standards are the same. Again, we expect that smaller practices are likely going to meet the intent of the standard using perhaps different mechanisms than a larger practice, but that's okay. But the accreditation is the same, the award is the same, but the fee starts at about a third of our lowest tier in pricing. And that's really so that organizations that it would be a barrier to entry to the practice would have an opportunity to enter specialty practice. So we just really felt that was an important thing, and we wouldn't want to hold anybody back. Now, there's criteria for that. You need to be independently owned. You need to be below a certain revenue threshold, and all that gets worked out with Jeff through his interactions and processes. But again, it was important to us to make sure that different kinds of organizations had access to our accreditation programs. And Jeff, I know that you have an opportunity to focus with smaller pharmacies as they're considering this accreditation program. Did you want to weigh in on anything here?
Yeah, I would just like to say that I work directly with our small businesses that are qualified for our programs, and there's just been a great response because so many organizations didn't even know that we offered small business programs. And they were really happy to understand that they could actually get involved and, like you had mentioned, pursue specialty or mail service to really expand their offerings to patients.
Great, thanks, Jeff. All right, and so with that, I'd like to transition now to some other accreditations of interest, which are not specifically in our pharmacy suite, but very closely align with a lot of the priorities of NCPA and your membership. So I'm going to transition to my colleague Laura Wood to talk through some of these programs.
That's great. Thank you so much, Heather and Jeff and Lisa, for kicking us off. I'm Laura Wood, and I'm not a clinician. I'm here to talk to you sort of a little bit from the heart about some of the accreditations that we offer here at URAC that I think really have a great overlap with some of the mission and vision of the work that you all do. So I'm going to specifically talk about community health worker program, health equity, and mental health at work. And I'll start by saying I don't go into the details of the standards because I really wanted to keep this sort of high level. And I'm hoping that I'll get some questions in the chat that I can respond to. And even if it's a more philosophical discussion about what we're doing here. My main goal is for you all to walk away to understand that if there were like a diagram of the things that we have in common, it would be larger than I'm pretty sure you think it is. So if you go to the next slide, I can start with our community health worker program. This is our most recent accreditation, and I'm really excited to talk about it because first of all, I know there's a C in community, and that's what we're here for, right? But I know that this is an area that's increasingly important, even to you as a community pharmacist and as members of NCPA. And it's also important to us, right? Because we want to be able to make sure that care is in the community. There's always that goal of like, you want higher quality care, you want to lower costs where appropriate, we want to keep people in their homes as opposed to having them end up rehospitalized and those kind of things. And listen, the whole point of this program is the program. So to be clear, this isn't an individual human being accreditation, it's for a program, and it could allow you, right, even as a pharmacy that has a community program, to show potential employees that you have their best interest at heart, really to also sort of make, and it's going to come up again when we talk about equity, to make sure that sort of your workforce aligns itself with what your actual patient population looks like and those kind of things. We know that community health workers are good in a lot of ways. We know that public health systems are interested in it. I used to work for payers. We were interested in it. And you all as community pharmacists are interested in it. I'll say one of the best things that I've taken away from learning about our community health worker program is that it really had the input of a broad variety of community health workers themselves, both individually and as a collective. So if you think about an organization like the Indiana Community Health Worker Association, they were very instrumental in helping us develop this program itself. And then if you look at, I actually have a list in front of me, so I can just give you some examples. So I'm the public health areas from states and other kind of areas. I'm from Kentucky myself. Kentucky Public Health had input in this. So when you look at these, this accreditation, when you see these standards, which somebody can chat in the standards at a glance if we want to, or you can reach out to me later. I'll give you my contact information. You can see that these are actually helping to like raise the quality of the programs themselves, so that community health workers can stay in the community providing the care that is needed. And I recognize that pharmacies also have community health worker programs within them. Any questions? No? Okay, so if we want to go to equity next, another one that I'm really passionate about. So Our equity program, again, I can go back and say one of the things that URAC is so good at doing is really bringing people to the table. We act as such a great convener, you know? So if you think about our equity program, it wasn't just developed by like 5 of us sitting around a table, and by us, I don't mean me, but the broader URAC. We had a lot of organizations that came to the table to help with this, not the least of which is the National Minority Quality Forum. They are our very much arm-in-arm partner in developing our health equity program, because we wanted to make sure that we reflected the needs of organizations that know more than we do about things like social determinants of health and other kind of equity issues. The great takeaway about this program for you all is to know that like we don't go in with any preconceived notions about where there might be inequitable outcomes within your population. What we ask you to do is take a look at your own data, and your data, yes, we'll send a recording, it'll be available online. And your data will then tell you where the inequitable outcomes are, right? So it could be based on like a rural population versus an urban population or suburban. It could in fact be based on age or race or gender, but we don't presume to know the kind of population that you have and where there might be inequitable outcomes. The great thing about this accreditation is it's designed for any healthcare system or any healthcare organization at all, right? So you could be a pharmacy, big or small. It is designed to work for you no matter your size. I would say, honestly, that our equity accreditation is a really good place to start if you're considering URAC accreditation. It's one that I think you can get your arms around pretty easily. Not saying the accreditation is easy, but getting your arms around it pretty easily can work for you. You can see here on the slide that it aligns with CMS framework. If you go to the link, which I think Jeff or somebody typed in for you, you can see sort of where that overlap is. You can also download the standards at a glance, and you can take a look at some more information about the equity program. Let's hit the next one, which is the one that I am sort of most passionate about. I will say in full disclosure, I always like to start the discussion about mental health with saying I believe that we should we need to remove the stigma for mental health and substance use disorder. And so I will say to you here today that the reason that I'm so passionate about this is I have personal and family experience with both MH and SUD. And if we don't remove stigma in our everyday lives, it'll continue to be an issue. So I offer that to you all as sort of like my heartfelt reason why this is important to me. And so this program is the only URAC accreditation that's not a healthcare accreditation, right? So it doesn't seem like a big deal, but it's a huge deal. It's the first time that we've really opened up our expertise and really trying to improve the health of all Americans, really anybody in the world, because our mental health at work accreditation is a workplace accreditation. And what I mean there is that it could be any kind of employer of any size, anywhere that's interested in focusing on the mental health of their employees. Now, we certainly started in the early pandemic times looking at the incredible amount of pressure that was on healthcare professionals. And that's really sort of the genesis of thinking about this accreditation. But then we realized that it was everywhere, right? Like we have some focus areas of law firms and other areas that are not anywhere in the healthcare sphere. But if you know anybody who works for a law firm or a bank, a big banking kind of financial institution, you know that also mental health at work is really important there as well. There's a lot of stress. So we then worked with an organization called One Mind at Work, and in conjunction with them and Columbia University and Ethisphere, which is an organization that identifies the most ethical companies in the world, we built on their index to build, this accreditation. And this accreditation has 10 focus areas that reflect entirely the work that they've done that say that if an employer focuses on these 10 things, it will improve the mental health of their employees. we have levels to it. So if you've ever been through, this is where I actually have to go back and say, if you've been through accreditation before, one thing that's very different about the mental health at work accreditation is that when you get your accreditation, there's a level to it. So most accreditations, the rest of ours are quite binary. Either you succeed or you don't for the most part. In this case, there are levels. So you could become accredited at a level 1, 2, 3, or 4, where 1 means that you're beginning your process of incorporating a mental health strategy into all the work that you do around, say, work design or communication or leadership involvement, all the way to level 4 that says that these kind of things are really fully integrated in your everyday activities as a leadership group, the way that you design the workforce, all those kinds of things. And then there's levels 2 and 3 in the in between there. So, you know, I really wanted to just take a little bit of time and say that these 3 accreditations, so the community health worker program we just launched like a few months ago, both equity and mental health at work, we launched late in 2023. There are a ton of organizations that are interested in each of them. And I wanted to really highlight the fact at a really high level that we have a lot in common with what our goals are for improving, improving equity, improving mental health, addressing community health workers throughout the healthcare landscape. And that, that sort of comports with the goals that you all have as community pharmacies, but also as members of NCPA. So I hope that that came through and clear to you. And with that, I am going to hand back to my colleague, Jeff, who'll give you a little bit more information about the accreditation details and then close us out. And I really do hope that y'all have questions for us. I do.
Great, thank you so much, Laura. Lisa, if you could go to the next slide, that would be great. So with the exception of mental health at work, our process for accreditation is the same. And there are basically 5 steps in the accreditation process. So an applicant first uploads their policies and procedures for our review. URAC conducts what we call a desktop review of all the policies and procedures. We actually provide feedback to the applicants. That way you can actually update your policies and procedures and resubmit them to improve your initial application with us. Again, our whole process is educational. We then schedule an on-site validation review with the applicant. And as Heather mentioned, with the majority of our programs, these are scheduled visits. They're not surprise visits. You have a full agenda ahead of time. You'll know exactly what personnel and documentation to have for that validation review. Finally, once the validation review is done, we submit the application to our independent accreditation committee, and they make the final determination of accredited status. And then, of course, there is ongoing monitoring during the 3-year accreditation period to ensure ongoing compliance with URAC standards. Next slide. The majority of URAC's accreditation programs can be achieved within 6 months. With the programs we talked about today, we provide applicants with up to 2 months to submit their policies and procedures to us once an accreditation application agreement has been signed. And then once submitted, we begin our work and we'll have that accreditation determination within 4 months. Next slide. One of the hallmarks of our process is the support that we provide our clients. Any applicant has both a client relations manager and an experienced accreditation reviewer assigned to your account. We also provide you with access to your program-specific accreditation guide, guide to using AccreditNet, URAC's accreditation application software, and access to URAC's Client Information Hub, which provides additional information, including educational resources for any of our applicants. Next slide. All right. Well, finally, I will be representing URAC at the 2024 NCPA Annual Convention in Columbus. It'd be my pleasure to meet with you in person and answer any questions that you may have regarding our accreditation programs. I'll be there during regular exhibit hours, so feel free to stop by. Again, it would be great to meet you in person.
I'd like to open the floor for any questions. I know we keep saying in the chat box if you have any questions. So yes, we are sending the slides and the recording. Heather and Jeff, I'm going to ask you both to come back on camera. Just to tell me a little bit about what do you hear from clients afterwards? After they've gone through the process, what are they telling you about things like their business improvement or anything like that? Any kind of just stories that we hear, ideally from applicants of all sizes, but especially from some more of our smaller pharmacies who may have thought it wasn't quite so doable, but then they found out, hey, that was a surprise.
I mean, I can go first. I have the opportunity to talk to a lot of organizations as after they've achieved accreditation because I'm the one that sends the communication to let them know that accreditation has been achieved. What we generally hear is thank you for making us better. Now it's a process, and I don't want to underscore that. I don't want to underrepresent that. The application does take some work, some effort, some commitment, I guess is the right way to say it, to submit your policies and procedures, amend them, update them, put some new things in place if necessary as you're going through the accreditation process. But I mean, as a pharmacist, I went to pharmacy school. I didn't learn about quality processes. I didn't learn about performance improvement. And having that in place in your practice is huge. It gets in front of issues. It helps you identify things before they go wrong. And I mean, just even from a regulatory compliance perspective, that is so key. And then from the perspective of the patient services that you're providing, making sure that you're providing the services that make a difference for your patient. Patients, like, right, all the work that you do requires resources, right? Resources are limited. You want to make sure that you're applying them in the best way and getting the most out of how you're putting that together. And the infrastructure around quality can really help you do that.
And Lisa, I would just add that because I work on the new business side, I work with our new clients. It's more really just giving them the help up front, understanding about the process, giving them the resources that they need to make a determination. Okay, is this something that will help my business, and will it help me meet my business goals as well?
And Jeff, I did see we had a question come through to the hosts and panelists about pricing. Jeff, pricing is really unique to every organization depending on size and things like that. But you put your contact info and you'll get a follow-up from Jeff later towards the end of the week to set that time. I think at that initial conversation to sort of say, what are your goals? What are your size? What do you do is really important before Jeff can even think about what your pricing structure might look like for URAC. So it's all dependent on many factors, all of which Jeff takes into consideration. So thank you so much for having us today.